Hi, how you doing?
Hi, how are you?
Doing well, how you doing?
My name's Briley. I'm going to be your nurse practitioner today. Today we're going to go ahead and do a head-to-toe exam, okay? The intent for this exam that basically we're going to point out everything that's normal and any abnormalities that we find.
Okay.
Sound okay to you?
Yeah.
Alright, if it's okay with you, I'm going to gather my supplies and I'm going to wash my hands.
Okay.
Okay? Alright, I went ahead and washed my hands. Can you tell me what brings you in today?
Just a general checkup.
Perfect. Okay, so go ahead and tell me, can you tell me your name and date of birth, please?
John Carver, 8/16/95.
Perfect. And go ahead and tell me just some history about yourself. Have you ever had any medical illnesses that I should know about?
No illnesses, no.
Okay. Any pain? Anywhere?
No.
No? Okay, what do you like to do for fun?
Work out.
Work out, okay. How active are you?
I'd say pretty active.
Pretty active. How many times a week?
I'd say 5-6 times a week.
Okay. Any family history? Can you tell me a little bit about your parents?
Dad has diabetes.
Okay.
I don't think anything on my mom's side.
Pretty healthy?
Mhm.
Okay. For your dad, how long has he had diabetes? And do you know if it's type 1 or type 2?
A few years, and I'm not sure.
Okay. So if he wasn't born with it, most likely type 2 has to focus on diet changes and also maybe taking insulin or something like that.
Yeah, he's a pretty good guy.
Okay, perfect. Next, just so you said you like to play sports, do you smoke or drink alcohol?
No, I don't.
No? Just for socially?
No, I don't. Not at all.
Not at all. Okay, nothing wrong with that. And then your health status. How do you feel about your barrier? Do you have any barriers to health care? No? So you're able to go to the doctor whenever you feel like you need to go?
Yeah.
Perfect. So you have insurance?
Mhm.
Good. And then are you in a relationship?
I am.
Okay. Any domestic violence that we should know about?
No.
So you feel safe and comfortable in your relationship?
Yeah, I'm pretty safe.
Wonderful. Okay, so next I want to just go ahead and talk about the different body systems and see if we can pinpoint any things that are wrong.
Okay.
Okay? So constitutionally, no fevers, anything like that? No sickness recently?
No, not at all.
Do you know if you come around anyone who's been sick recently?
Not that I know of.
Okay, wonderful. How's your eyes working? Any difficulty seeing?
No.
Any blurry vision?
No, ma'am.
Perfect. Have you ever been to an eye doctor?
I have.
Okay, so you've had your eyes checked in the past and you've had good vision.
Yeah. Mhm.
Good. Ears, do you hear okay?
Yeah.
Any plugged ears, like any fogginess in there?
No, not at all.
Good. What about your nose? How do you feel like your smell is?
Pretty good.
Good smell, okay. And your throat, any difficulty swallowing or chewing?
No.
Perfect. Next we're gonna move into the chest area. Any chest pain, difficulty breathing?
No, ma'am.
Any shortness of breath?
No, ma'am.
All right. Talking about our bathroom habits. Peeing, do you have any difficulty going to the bathroom? Any urgency or frequency?
No, I think everything's pretty regular.
Good. Any burning with urination?
No.
All right. And bowel movement. When was your last bowel movement?
Today?
Today. Okay. Any diarrhea?
No.
Any constipation?
No, ma'am.
All right. Moving on to musculoskeletal. Any weakness? Muscle weakness? No muscle weakness? Okay. So you're a pretty active guy. You don't have any muscle injuries or bone injuries that we should know about.
Not that I know about.
Okay. And skin. I'm looking at your skin. Your skin looks pretty good. Do you have any rashes or anything that you're worried about?
No.
All right. And now neurologically, any dizziness, lightheadedness, difficulty concentrating?
Mm-mm.
Perfect. Do you have any psychological history like depression, anxiety?
No.
No. Okay. And last but not least, do you have any allergies?
No.
No allergies that you know of.
Mm.
All right, so we're going to go ahead and start the physical exam if you're okay with that.
Yeah.
All right. So I'm just going to go ahead and adjust the camera just a teeny bit. All right, so the first thing we're going to do is we're looking at your general appearance. I can tell that just from looking at you, you're an active guy. You seem like you follow a good, healthy diet. You're sitting upright in the bed, and that's a good sign. You have good posture. Hygiene-wise, clean, taken care of, has a haircut, so no worries there. Just from mobility-wise, I see you sitting up in the bed. Your muscle seems fine. That's good to me. And you're positive. You're a really good historian. So let's go ahead and get started, okay? So prior to the exam, we took vital signs. Temperature is 97.5. Blood pressure is 120/80. Respiratory rate is regular and unlabored with 16 per minute. The pulse is about 100. He's an active guy, so it's okay if it's a little bit lower than normal, that's fine. And go ahead and tell me how tall you are.
6'2".
And your weight.
195.
So BMI is in a healthy range, no concerns there. Now we're going to go ahead and look at the head. So I'm feeling the head, the cranium shape is nice and round. I don't feel any bumps or lumps. I don't see any bruising. The hair in the scalp is good. The hair looks healthy. I don't see any excessive dry skin or anything like that. No concerns here. Next, we're going to go ahead and test cranial nerve 7. So I'm going to need you to close your eyes and go ahead and give me a smile, please. Perfect. Next, I'm going to be palpating the temporal arteries. You can open your eyes up. So I'm palpating. I don't feel anything abnormal. And now we're moving down to the jaw. We're testing the TMJ. Go ahead and open your jaw for me. Perfect. Close it. Good. So just from that, we can go ahead and see that he has good jaw strength. No concerns there. Now I'm going to go ahead and palpate your sinuses, okay? I want you to let me know that whenever I'm doing any of this, if you're feeling any discomfort, okay?
Mm-hmm.
Nothing?
No.
Good. So no discomfort when we're palpating sinuses. That's a good sign that he doesn't have any backup in there. His sinuses are clear, so no concern for any upper respiratory infection. All right, the next thing we're going to go ahead and do is we're going to do an eye exam. So I'm going to grab a little light, and I'm just going to have you look at the light, and we're going to see the way your pupils respond. Okay? All right, I'm going to actually dim the lights for this one. All right, so go ahead and just look straight forward. Thank you. Perfect. Lights back on. So after the eye exam, your pupils are equal and reactive, meaning when I shine lights in them, the pupils, they constrict and dilate at an even way, and so that's a good sign. Perla is present. Next, we're going to go ahead and do the 6 cardinal positions of gaze. I just want you to go ahead and follow my finger, okay? Keep your eyes straight and just follow my finger. Perfect. Next I'm going to do is I'm just taking a look at the external eye. The sclera is white, which is good. I don't see any redness, so these are all normal signs. Next I'm going to do is I'm looking at the conjunctiva. I don't see any some conjunctiva, which is sometimes that goop or stuff you get when you have like pink eye. So all of that looks normal, no concerns for the eye there. And we're going to finish this eye exam up with a vision exam using the Rosenbaum chart. So I'm going to go ahead and grab that. So I'm standing back here. I just want you to go ahead and follow each line. Go ahead and cover your right eye, please. And I want you just to read off. Go ahead and start with this line right here.
F, P, H.
And again. The next line.
L, C, F.
Next line.
D, H, J, B, S.
Next line.
E, P, T, Z, O.
Next line.
C, F, D, H, J.
And the last line, please.
L, T, F, P, H.
Perfect. So your left eye has 20/20 vision. Go ahead and cover up your left eye. And now we're going to go ahead and do the same test. You can go ahead and start on this line.
F, P, H.
Next line.
O, L, C, F.
Next.
D, H, J, B, S.
Next.
E, P, T, Z, O.
Again.
C, F, D, H, J.
And last line.
L, T, F, P, H.
Perfect. So, again, the right eye and the left eye are both 20/20 vision, which is a good finding. Next, we're going to go ahead and we're going to use the ophthalmoscope to take a look at your red reflex, your retina, inspect your optic disc, and also your macules. So I'm just going to have you look for it, okay? So I have a positive red reflex in the right eye, positive reflex in the left eye. The red reflex is basically when you take a photograph and you see sometimes people will have red eyes. That's what we're looking for. All right, so I'm looking into the eye. I see the retina, optic disc is present, and the macules. All right, so the next thing we're going to go ahead and do is take a look at your ears, okay? So first we're inspecting the outer ear, the auricle. Everything looks good. I don't see any abnormalities, no redness. Perfect, and they're symmetrical. We're going to go ahead, any tenderness when I'm palpating your ears? No? I'm going to grab my tool and we're going to take a look inside your ears as well.
All right.
All no obstruction. The only thing I see is some earwax. That's normal. Again, no obstruction. The tympanic membrane is pearly and white, and the cone of light is at 7 o'clock. And the same with the right ear. The tympanic membrane is pearly white, and the cone of light is at 5 o'clock. So these are all normal findings. The next thing we're going to do is test your hearing. Okay, we're going to do what's called a whisper test, a Ren's test, and a Weber's test. So for the whisper test, I'm just going to stand beside you. I'm going to go ahead and whisper some things in your ear. I just want you to repeat back to the camera what you're hearing. Okay?
5W9 2XY.
Perfect. And we're going to go to the other ear.
B82 7511.
All right. And from that test, the whisper test is normal. His hearing he did repeat back the whispered words correctly. The next thing we're going to do is the Ren's test, okay? The Ren's test is going to test for air conduction versus bone conduction for hearing.